All right, so it's 7:01 on Wednesday, March 16th, 2022. We'll call this Board of Health meeting to order. Present Candace Linehan, Laura Glorville, and Elaine Silva. Cindy and Anthony's coming in right now. Melissa's here. Melanie Deneen. So why don't we go ahead and talk about the minutes? I feel like they look good to me. Anybody? Any thoughts?
I didn't see anything. Laurel, did you?
No, looks good.
Okay.
Have you changed your font? I feel like the font is new, but other than you try to change things up, Cindy.
You know what? It's a standard font that Jen wants us all to use. So I don't know.
Oh, no wonder.
But it's been the one I've been using.
I don't know. Maybe I'm making it up. Looks good. I make a motion to accept the meetings from the meeting of February 16th, 2022.
I'll second the motion.
All in favor?
Orville, aye.
Silver, aye.
Linehan, aye. So moved. Okay. And then Anthony, how's it going?
It's going well. It's nice to see everybody.
You too. Did you and Melanie want to go next to talk a little bit about the grant and we can get to know Melanie?
Yeah, that would be great. So I'm really happy to have Melanie. Melanie's joining us today. She's going to be going over some of the shared services grant, some of the things we've been working on, and some of the things that we hope to do more of this year. So thank you for being here, Melanie.
Maureen just texted me she can't log in, but I'm sending her a new link.
Thank you, Anthony.
Okay. Melanie, I think
can you hear me?
I think your video might be frozen.
You can hear me?
Yep, we can hear you.
Your video is frozen, but we can hear you.
How about if I do this? Can you hear me now better if I stop the video?
Bless you.
Bless you. It's a little bit choppy. It's a little bit staticky.
Hello. All right, I'm gonna go. All right.
Okay, I think you're good to go.
It worked a second ago.
We can hear you.
All right, so as you may know, in 2019, the state, okay, good. The state had a stakeholders group and third party do an audit of public health in the state. And they created something called the Blueprint for Public Health. And it outlines what the state needs, local public health needs to add, what its shortcomings are, what its strengths are, and what we should do for essential services at the local level. In response to that, the state funded these public health excellent grants. Okay, and the goal is to really, it's the state really to allow local public health to decide how to meet this minimum requirement. How are we going to make sure all of our deliverables of inspections and services are get to the public? So with this, they hired me as a director of this grant, an inspector, and a part-time communications specialist. To date, we've had some turnover at the inspector, but we're looking to rehire the inspector for the region this month, or start the process again. We have a part-time communications person. Our biggest achievement to date is a revamping of the Mystic Valley Public Health website. I invite all of you to take a look at it when you get a chance. Give me any and all feedback. I'm responsible for all the mistakes, but none of the beauty. That was all done by Hayes, the communication specialist. The other main that we're working on, training for staff. So making sure everyone in the region, all inspectors and directors, have the minimum requirements for training. So are they trained in food inspections, if that's what they're doing, lead determinator, housing, depending on their position.
We might have lost Melanie there.
I wonder if we should text her and tell her to call in instead.
Yeah, maybe we can. I'll give her a text.
Because hopefully that won't depend on her service.
Okay, I'll just give her a second here to respond to the text. Yeah, I'll just keep going off of a little bit of what she was saying, and she'll come back and finish her thought there. But essentially, the shared service grant has evolved over time. It's changed since the initial writing. It's changed since Elaine's been here, and now it's changed once again. So we have a common goal here. Essentially, it's for all the communities to meet certain minimum statutory requirements, and a lot of these fall under the inspections branch. And so a lot of our communities are shorthanded at the inspections, where we're still under the assumption that we're trying to at least do one inspection per year for all establishments, regardless of risk level. But we're, based on the personnel that all these towns have, generally we're not able to do that yet. And we know that there is a higher standard to which we should be aiming for, which is, based on risk level, and that's type of food they serve and number of patrons that they serve. These different establishments have different risk levels, and so the ones that are higher risk level, we do want to do more inspections for, generally just for the safety of the town. However, we have currently been operating under, I believe, half inspector here in Wakefield, or 2 half inspectors, so one FTE essentially, up to December of 2021, and we've been trying to fill our positions since. So we're happy to announce that we're going to be looking at bringing on a full-time health inspector for fiscal year 23, and we're going to hopefully be able to fulfill those requirements. But in terms of the shared service, we're looking at different ways to really maximize some of the things that we can do with it. What we're trying to look at different programming ideas that would create long-term benefits. One of the ideas that is related to inspectors, but not necessarily hiring just new inspectors, is the idea of a training program. And so we can work within our communities here to provide kind of a curriculum for new inspectors or potential folks that want to join the inspections round. So there's technically no specific inspector training program in Massachusetts at the moment. And so for us locally, we can fulfill that gap by having some number of individuals come through and do kind of an internship program. And this curriculum would be vetted by Melanie as well as Coral Hope. And it would be great to have the two of them with their experience to put together kind of a training curriculum that we can have people go through. And that would help part of it. It looks like Melanie might be back. Melanie,
I am, but where did you? I can. Can you hear me?
I can hear you. Much clearer now.
Much better.
I'll let you kind of continue where you left off there. I was just filling them in on some of the things we've talked about that we want to do, but I'll let you continue.
Okay, where did I don't know where I left off. I was talking about the trainings we're going to be offering.
Yes.
Did you hear that?
We heard the very beginning. If you want to start from the beginning of that.
Okay, so we are offering, the inspectors are engaged in training for a Serve Safe class, and also there's a couple inspectors are taking a certified pool operator training course. We're going to be offering the Serve Safe regionally in Medford on April 6th. We also are offering tips training to all industry people on Tuesday, that is free, in conjunction with the Boys and Girls Club of Stoneham and the prevention team. So we're looking for anybody who wants to learn about safe alcohol serving. And lastly, we're going to host the Food Safety Advisory Committee, which is the food safety group that meets with inspectors and industry that meets with together to discuss food safety issues. We have a lot going on. What else can I fill you guys in that Anthony said, or can I answer any questions? Hello?
Oh, Elaine.
Elaine, you might be muted there.
Not very often I'm muted, so. Melanie,
I didn't hear you.
Yeah, how is it going with, like what is your plan on how to take that one inspector and put that inspector available to the whole coalition? That was one thing when I left, you were just starting to do, because it's like 5 communities. So how will you divvy that inspector up so that it's evenly?
Well, that's the thing. We're not going to be able to do even. That is something we did with the first inspector. We gave every town 1 day a week, and that did not work evenly. We're going with equitable. Equitable and filling the gaps. We have at least one community that doesn't need an inspector, and we're looking to have each community communicate on a monthly or weekly basis to me what their need is, and then send the inspector out by priority level, and making sure everybody gets best they can, what's reasonable. And that's what'll be my job, to make sure that people get what they need. And also we don't, having an inspector go 1 day a week to each town ended up kind of making the person, when they were doing some complaints, follow up kind of difficult. They were at a lot of different places.
Yeah.
We're looking to improve that.
Hey, Melanie, it's Laurel. Thank you very much. It is kind of cool to remind ourselves what part of our function is. And I think we haven't been focusing on inspectional services for quite some time. We were very excited a few years ago to sort of be the leaders in the food codes, making more sense for current industry. So I think that's great. And I agree, equitable is not the same as equal. and it doesn't, it's kind of like you can get nothing done with your prior model. So hats off for recognizing that. And I hope that, maybe it'll be interesting to see 6 months to a year from now, how that model's working out.
Yes, I think there's a need for more. We think we need 3 inspectors doing. So that's the biggest challenge. Is not that people don't want the inspector, is that there's a great need, specifically post-COVID, because all of the staff was doing so many other things.
Yep, for sure. Well, welcome to the team. So that's
Thank you. I am excited to be here. I'm excited to be here. It's been good.
Good.
Okay. Well, it sounds like I think we've covered a lot. Again, thank you, Melanie, for coming on, giving us an introduction. And I think there's a lot that we could do with this grant, and hopefully moving forward, we'll have more consistent kind of updates with the board on things that we'll be working on. I think the inspection piece is really important that we just highlighted, but there's other things that we can work on. So thank you again, Melanie.
Yes. Yes. All right. Thank you.
Thank you, Melanie.
Thanks, Mel.
Bye-bye.
Anthony, to that comment, I do believe at one point we did talk about, a master whiteboard in the department. It may be there on kind of what's coming, or what, kind of the framework of where the priorities are for the board, for the department, not the board. But a quick picture of that in back to the board, just as a, FYI, this is what this looks like. Gives a nice visual, because it's astounding how successful the department has been in securing grants. And I know that Catherine at one point had just sort of talked about a visual timeline, so you could sort of see where things were running out, what was being done under them. And it was helpful for the visual learner to
yes.
see.
It's a good thing. It's a good thing you're bringing that up, because Catherine and I had a discussion just the other day about, there's a lot of grants going on. There's a lot of new funding opportunities, and so in different positions at different timelines, right? So I think you're right. I think it's a much better visual representation if we're able to put that on a timeline to show, what's coming up, what needs to be reevaluated, and where better we can spend our money and time. So yeah, we'll definitely have that put together, and we'll share that with the board as kind of part of our summit.
Thank you.
Anthony, I noticed there's not a health director's report on the agenda. Is that because everything's awesome, or?
No, I didn't want to write one. No, no, I think
nothing to report. Everything's great. Carry on.
On his goals for fiscal year 23. He'll start writing them.
Yes, yes. I think one of the big things, obviously, and I think all of you have been involved one way or another, has been a lot of our time has been taken up with budget season here. And so we're very happy to announce that we've received a lot of support for all the things that we've talked about. I think the social services coordinator was a big piece. I know this is something the town has been looking for a long time, and we've been strategizing with just about every community partner we could think of ways that they can spend their time the most effectively with them. And this is all conversation before we even have this person here, but it just goes to show that we have quite a plan for them. How they can both be most effective. I think we're seeing a really great opportunity for them to work with schools, work with families in combination with some of the SROs and some of the adjustment counselors. We also see an opportunity for them to step in emergency situations. We just somewhat recently had the Audubon fires. And so another great example of someone that could help coordinate services that isn't kind of a piecemeal between our inspector and our substance use coordinator. So it's an important piece that we were discussing, and we have kind of a roadmap laid out. And I think one of the biggest things that we wanted to address in all of this is the need for understanding how the health department can impact both the prevention side as well as the recovery side. And so we can work on all these things. And so we have Catherine working on the substance use prevention. We have another DFC position that we're looking to bring in, kind of a community services coordinator. These positions I would squarely put in the kind of prevention side of things. But when you get down to it and you get to the point where there's an emergency or there's an emergent situation where folks are in a tough spot, we would like to have someone like a social services coordinator that can step in and be part of the response. So we kind of try to cover all parts of it. So I think it's an important piece that we wanted to stress when we brought the project before the town. In terms of the other pieces that we looked at an assistant public health nurse that would be specific to Wakefield. And I'm glad Melissa was able to join us tonight, because I think this is a good opportunity for us to discuss a partnership that we could see. So, Melissa has been doing an amazing job covering both towns for both Melrose and Wakefield needs. And I think there's a piece that we can expanding on some of the education, some of the outreach that we can do with Melissa and this public health nurse could achieve a lot in the community. And so I think it's a great opportunity. I don't know if Melissa wants to chime in a little bit about what you might see with this.
Well, I think that there's a great opportunity to do a little bit of cross training so that there'll be two of us, but we'll be able to work to promote some new initiatives within the Wakefield area that maybe we have been doing in Melrose, like more senior housing visits and things like that we weren't doing before, that they were going through other agencies or doing internally.
And one of the things I wanted to stress was, glad we have a lane here. We've been leaning on a lane a lot, especially when Melissa's, got other things going on, or, just in general, we've been leaning on Elaine's expertise and willingness to step in. But one of the things we want to make sure is that we have sustainability in the department. And I think an assistant public health nurse can help take over some of those things that, are so time consuming, right? With camps coming up, with, and then later down the line, we have possibly blood pressure clinics and with flu clinics and eventual COVID clinics, I would assume. All of these things are going to be logistically a lot to do in terms of preparation and time spent. So I want to make sure that we have the appropriate staffing for that.
But I still will be seeking volunteers.
But I think it's a time, Anthony, I don't know if everybody's aware, but Melissa is, the public health nurses across the country, especially here in Massachusetts, we have really taken on a lot of responsibility the last 2 years. We're doing a public health nurse survey, which Melissa, thank you. I heard that you did do it. And there's a lot of legislature coming up to support public health nurses. And we're also trying to increase our presence in the state and in the legislature. We have one public health nurse, Glynis LaRosa, who has been wonderful. And we're now looking to put another full-time position that will give us a little bit more insight. And I think having a nurse here, even though it's part-time, has always been my dream. I think Laurel has always heard me mention that. I believe that every community should have a nurse. I believe every community should have a full-time nurse, but I'll take a part-time and especially to help Melissa and to be able to outreach and do the educational piece that we in public health really want to do. And I think we're going to be called upon in the next year or two to do even more. So I'm very, very excited. And I thank you for even attempting that.
Yeah, so thank you. I think I think we all recognize the need for, for additional services, and I think this is just one step towards that. And I guess the last position that we've already kind of talked about, the shared service grant, but that's just the additional health inspector. So it's not necessarily actually one new FTE. We actually had a half, so we were splitting both the senior health inspector position and the health inspector position with Melrose up to this point. But in the new fiscal year, we'll be having a full-time health inspector and continue to have Coral split between the two communities. So we'll have basically 1.5 FTEs for health inspections. And so I think that piece is it's just been so important, because we can then, we don't have to take as much time out of the shared service shared service inspector that may need to serve other towns that are a little bit behind in inspections. But in general, we have so many inspections to do. Just based on the risk-based calculation for a number of inspections, I believe we're at 238 inspections that we should be doing for just food for the last year. I believe with one full-time just food inspector, we would be able to fulfill, I believe, 173 of those inspections. That's based on the risk level 1s, risk level 2s, 3s, and 4s, and the corresponding number of inspections. So even with the full-time inspector plus the half-time senior inspector, we still would not reach fully our inspections goal. But it is a step in the right direction, because we have so many food establishments, and we also have housing. I think one of the things that I can actually do a better job of explaining at some of these meetings is that food is not the only thing that we inspect, and the inspections are not standardized, right? We don't go in there, we don't spend 15 minutes and we don't leave. These inspections, could vary depending on the complexity, what we find in there. But also we have to count the number of hours during the re-inspections. We have to go back. We have to make sure that we follow up with, food permits that have been suspended, those kind of things. But then that's just all in the food arena. Then we move really into housing. So housing inspections, equally important, if not more. There's a lot of cases where we have to spend, just a couple of hours, looking at certain properties and seeing, if our things are up to code. And then there's a lot of follow-up with that, right? So connecting this person to, connecting folks to resources they need to get them up to code, or if they need help with anything else, it's a it's kind of an involved process, and so it's very difficult. We can count up the number of housing complaints that we respond to per year, but that's just scratching the surface. It doesn't go to show how many follow-ups we do, how many phone calls that we take, that we have to go back out and check on something. You know, it's one of those things that we have to do a better job of representing to the town. Okay, sounds good. So I think that's it. Are there any questions?
Maureen, are you ready to talk about tobacco?
I am here.
Awesome. We see you.
Okay. I will possibly be a little distracted because I had painters here today painting my kitchen cabinets, and they just finished up and they're moving the doors of the cabinets back into the house to dry overnight, I guess. So anyway, if I seem distracted or if somebody walks behind me, that's what that is. Anyway, you may recall that at the last meeting that we talked about the updates to local tobacco regs. And in fact, you adopted updates to the tobacco regs so that they line up with state law. So that's done. That was pretty straightforward because we weren't making any changes to regulations. We were just getting ourselves into line with the state law. Now, what's next? Just this week, what day was it, Laurel? Tuesday, we heard from the Wakefield High School SRO that vaping is still a huge problem. And so one of the things we want to think about, is there anything else that we can do? We've done a lot, no question about it, both on the state level and locally, but is there anything else that we can do to further restrict access to these products so that our youth have less opportunity to get them? We make it harder for them to get them, you know, or anything else. What can we do to keep youth from not just vaping, but all of the addictive nicotine products? So when we think about tobacco control, we think about the 3 Ps. So the 3 Ps are price, product, and position. So price, we've actually done a lot in this state. Massachusetts has a very high minimum cigarette price. And here in Wakefield, several years ago, you adopted a minimum cigar price. So we know that price affects use. So these are important. Position, where are these products? So Wakefield has a permit cap, a good permit cap, which limits the number of places you can buy tobacco, as well as limiting the number of places where our youth see a huge array of tobacco products. We know that advertising and exposure affects behavior. So not seeing these products everywhere youth go is very important. Now product, the flavor ban obviously is critical. Is there anything else that we can consider? So a few things that you might consider, and in no particular order, just to let you know, 184 Massachusetts cities and towns have a ban on blunt wraps. Wakefield does have a blunt wrap ban, but it has an exemption for adult only stores. So that means vape shops and smoke shops can and do sell blunt wraps. So one thing you might consider is removing that exemption and just tightening that up. 9 cities and towns in Massachusetts have a rolling paper ban, including Malden. Malden has a long-time rolling paper ban. So you might consider a rolling paper ban. And if not a complete ban, at least a flavored rolling paper ban. So it used to be, we'd see rolling papers, but that's what they were. They were papers. Now what we're starting to see is flavored rolling papers. And to me, the only reason that flavored rolling papers would be available, why would a manufacturer go to that extra step, is to enhance the product that someone might use with a rolling paper. Let's see, and this next one is more related to ETS, environmental tobacco smoke, but still something to think about. Massachusetts, as you guys know, has very strong smoke-free workplace laws. And as a standard practice, sampling of tobacco products is banned. meaning that you can't enter a store and light up a product to see whether or not you like it before you actually buy it. And so that works in Wakefield, except that we have an exemption for adult only stores. So somehow our adult only stores were grandfathered in, and you could, the older ones, the ones that were already here when that ETS law came into effect, regulation came into effect. So there's no sampling in the vape shop on Albion, but there is sampling in Mark's Smoke Shop in Town News. So we're concerned about sampling because obviously anytime a customer or anyone enters an establishment where they're smoking, they are exposed to secondhand smoke. And I don't need to lecture all of you about the dangers of secondhand smoke. So backing up a bit, rolling papers, blunt wraps, and sampling clearly fall within the purview of tobacco regulations and are things that you might consider. Something else that would be, frankly, would be edgier that you might consider. A reminder that the new state law limited the nicotine content in e-cigarettes in family-friendly stores. So you can get up to 3% nicotine content e-cigarettes in a family-friendly store, and then adult-only stores can sell higher content products. And the reason they did that is because we know there's evidence that the higher the nicotine content, the more likely someone is to become addicted. So one of the relatively new products that we see growing in popularity is nicotine pouches. You might hear the term Zyn. It's actually a brand. Zyn and On are the two most common brands that we see in local stores. Zyn comes with in 3% and 6% nicotine content, and On comes in 2, 4, 6, and 8%. So if we think back to what the state did, and they limited the nicotine content in e-cigs sold in family-friendly stores to 3% because higher nicotine content is bad, then here we have these nicotine pouches with 2, 4, 6, and 8%. So that seems like a lot of nicotine for somebody to be absorbing. So just something to think about. And by the way, anecdotally, at least, we hear that nicotine pouch use among our youth is on the rise locally. And then lastly, other products that we're seeing in greater numbers, and I think I've mentioned these products in previous meetings, are Kratom and Delta 8. Neither Kratom nor Delta 8 are tobacco products. So it wouldn't be tobacco regulations, but these are products that we have concerns about. Both of them have been, there have been CDC advisories on both of them. Kratom has been around for quite a long time, but now I'm seeing it in many other forms. I used to see it in powder, and then it started coming out in capsules, but now I see it in soda, chews, and shots. And Delta 8 is really a brand new product. I've only been seeing Delta 8 maybe in the last year. And Delta 8 is actually synthetic CBD. So we know CBD products, which are supposed to be, they're from the hemp plant and cannot have more than 0.3% THC. In order to be CBD, can't be more than 0.3% THC, because more than that, and it could make you high. That or less, and you can't get high, so it can be called CBD. So what I'm seeing with Delta 8 products, there's not much. I haven't found any scientific, journal articles or anything about it, but I do see when I find a new product and I Google it, then I see reviews and ads for the product, and I see things that say gives you a good buzz, makes you high. This one's better than that one, or whatever. And if it makes you high, then it can't be CBD. The CBD doesn't make you high. So I have a concern about these products. Some of my colleagues do. We don't enforce on them, but we see them in the stores, and we are concerned. So maybe just something for us to think about and look at, down the road, in addition to any other tobacco regulations that you might decide you want to consider. Questions on that?
So I did just pull up something. First of all, both products are readily available on Amazon. Fun fact.
Yes.
So you know, when we're talking about psychoactive products out there. So what I had not realized is Delta 9 tetrahydrocannabinol is THC, essentially. So the Delta 8 is, you know, one of the other derivatives of the marijuana plant. And, you know, once again, you know, people have some workarounds. So they're talking about it having 50 to 80% of the psychoactive effect of Delta 9. Not as high, but psychoactive is concerning. And, you know, the whole world is all over the place on this. They do have a side effect panel advertised in this article that makes it similar to THC: vomiting, hallucinations, loss of consciousness, trouble standing, memory loss, trouble with coordination, dry mouth, and changes in appetite and weight. So those are things that have been looked at. You know, we've got to get the FDA to actually study this.
Yeah, absolutely. It's fine for the CDC to do an advisory to the medical community and say, be on the watch out. We've seen, you know, we've heard reports about this, but you're right. We really need the FDA to do it. But considering how long it's taken the FDA to do the, to enact the flavor ban that is actually part of the, I think it's part of Obama's 2009 family healthcare, whatever that was, then yeah, it might be something that we, if it is a dangerous product, might be something we can't afford to wait for the FDA to act on. But I agree with you, it should be the FDA.
Do you know, so in this, it says as of August 21, 18 states have banned or placed restrictions on Delta 8. Do you have any?
I did not know that.
Fun fact, oh my gosh.
Thank you, Laura. It's, you know, it's not a tobacco product and I didn't, yeah, what article did you read?
I'll send
it to me, please.
I'll send these to you. So, you know, so it, and, you know, just so you know, psychopharmacologists and psychiatrists, you know, we always ask, you know, when, you know, it is part, you know, and aside from regulating, because we always like to add education, is, you know, these things need to be included when a provider asks you what medications you're on.
Right.
Really, you know, medication, substance, the caffeine is right up there as well. And then the Kratom.
By the way, Laurel, I did send an inquiry to both the AG's office and to, I actually sent it to Senator Lewis's office just because, you know, I know he has a good staff to, you know, let them consider looking at this from their particular purpose.
Yeah. But once again, you're on the cusp.
But local, but we know local is more nimble, moves faster.
Yep. And then Kratom, just so you know, it's been around a long time. It's from a tropical tree in Southeast Asia. And it's mostly ingestion. But again, at low doses, it's a stimulant, and at high doses, you know, so alertness and physical energy. So, you know, that's probably why people are sticking it in energy drinks. But it can also, there's some small cases in psychosis and hallucinations, delusions, and confusion. So, you know, we can do all of this with sleep deprivation. You could probably do this with too much, you know, it's all, you know, we want to be careful. And it too is not controlled.
Yep.
So, you know, so I guess you know, my thought again with the Wake Up crew is, just as you said, you know, what can we do with regulation? I've always worried sometimes that it's whack-a-mole. And so if you try to do the regulation without other things, that you're just pushing the behavior elsewhere,
right.
underground. But also, you know, including this on, you know, just making people comfortable with an ad campaign, knowing what this stuff is. So, you know, more to follow. I think maybe we should bring that up to the group in our substance use coalition, or anti-substance use, and really think about the education piece of this. I don't know about all of your cool suggestions. I need to think on them. I did not realize that we had grandfathered Marks for tasting.
And town news, both.
Well, town news, I think got it because isn't in the regulation we said standalone, and so we had it just to bring everybody up to speed. Elaine and I were there. Maureen, I think you were there too.
I was there too. Yeah.
On a fateful night where we were questioning the smoke-free workplace requirements, and the building that Marks is in has, lots of dead space in the ceiling, and and as you know, secondhand and third-hand tobacco is easily spread. And the new monastic shop just next door, all of their paper is just loaded with tobacco scent. And it was interesting to see what people's impressions were, and it can be a bit contentious. All we were asking for was for them to demonstrate any kind of ability to have a supersonic filtration system. And we proceeded to have a public hearing where people were espousing the health benefits of cigars, and it was just the wrong audience. So at any rate, we did then say that if I, and I would need to pull up the regs again, but, going forward, we would only allow a standalone building, which the new shop is standalone. It doesn't share airspace with any other agency, right? Because it used to be.
Yeah. So that would, and I remember the discussion, but I think in the ETS regs, it only says no smoking any place, the standard language, right, except for adult only stores.
Right.
Those that only allow entrance to the 21 and older. So I don't think that wording made it.
But no, I'm pretty sure we also made sure it was a standalone structure.
Mm-hmm. It was, yeah, he was grandfathered, Marks, for now, but any other facility that opened from then on would have to be in a standalone. In fact, for those who weren't there, our case was a state case. I remember it was talked about all over the state because we were the first ones to really bring that problem with. And I think that's one reason why he'll probably never move, Mark. But Maureen, I don't know, Laura, to me, there was something about the sampling too. Didn't we have something about the size or something, or how long it really would be for them to do that?
Oh, you think there was a duration on it? Okay, that I don't remember. What I do remember is that, if I go in there and somebody's in there smoking, they always have a package that looks new, opened with one cigar taken out of it, so they can say that person is sampling a new product. So that meets the, their requirement. But I don't remember that. I remember it wasn't written into a reg, but I think it might've been in a letter. Cindy might remember that there were requirements on the size, and, there was so much precise information about the air filtration system. And, I would go into Mark's to do an inspection, and he'd want to show me the paperwork and how much it costs to, many, many thousands, tens of thousands of dollars to put in that system.
Mm.
I always used our case for smoke shops opening up when someone would come, either want a cigar bar or something like that, and to remind them of the filtration systems and how much it costs. And that was a huge thing in Boston. I don't know, Maureen, you probably had it with what's his name did them, and he came to us about hookah bars and cigar bars, and the filtration systems were like 80 and 90,000 for these people when they opened up their facilities, and that's what stopped a lot of people. But I always thought that it was something about the size of the cigar, so that it would limit the tasting, the sampling to like maybe 5 minutes, so it wouldn't overcome the area.
Yeah,
would have been a good idea, Elaine. I don't remember it.
We need to pull it back. Well, yes, because there was the ode to, it's not a hookah bar, but I did my PhD there. It was these people were
wrote the book while they had a cigar.
It was an incriminating meeting, I would say, but there was a lot of information shared. So we made sure that we regulated that we would not have hookah bars, and that the sampling would be limited. So I would suggest we dust off that regulation and highlight it to see where we're at with that. I don't know, Maureen, if you have it handy, but we should be able to pull it up.
I think Cindy, were you able to pull that up just before when I was having trouble getting on the meeting? Did I see that come through?
Yes, I sent it to you and Anthony.
Oh.
Okay, you might as well send it to us all just to remind us how we wrote it.
We're talking about the ETS regs, is that correct? The environmental tobacco smoke regulations?
Maybe.
I think this is in reference to the prohibition of smoking in workplaces and public places.
Yeah, but I thought it was within our tobacco regs. So I need to.
Yeah, no, not even. The blunt wrap ban is in the tobacco regs, I believe, but the exception to the blunt wrap ban, I believe, is in the, I'm looking for it right now, in the ETS reg. Which we often don't look at the ETS reg, but it's kind of, a little bit hand in hand with.
Yeah, I kind of recommend that between now and the next meeting, the board just reviews the language that we had done, look at the date, come back to you, Maureen, to see if, there's still loopholes even with the new mass regs. Just to make sure that we don't keep hitting this. And I think I would be in favor of a flavor ban. Thing is, Amazon's going to supply all of this stuff, right? So, I don't know how effective we're going to be, but it is nice to get it away from quote unquote family friendly stores where, you've always been so careful on the positioning to make sure.
They're already not in family friendly stores? Aren't they at adults only stores?
The flavor, yes.
The flavored papers are in adult only stores, right?
No, they can be anywhere.
But
there's
is it was it the blunt wraps that are only in adult stores?
Yes.
Okay, thank you.
Yep.
And I wonder, forgive me for being ignorant, but is it that most of our young people, when they're getting their hands on this stuff, are they having older yet still young people purchase it for them, or are they buying it themselves and not getting ID'd from family friendly stores? Like, where are they mostly getting it from? Because I hear that we're talking about a bunch of stuff that seems to happen at adults only stores. And is that because that's a way that young people are getting their hands on it?
Yeah, kind of two separate things. There, might be some loopholes because of some, exemptions that were created, made, given, or whatever. So we're trying to tighten those up. And then in terms of youth access, we're always looking for ways that we can try to have fewer of these places people can buy them, less available, that kind of thing. But in terms of where youth are getting them, we had a side conversation after the wake up meeting on Tuesday, and it's the same old. An older sibling buys a bunch of them, someone goes to New Hampshire. By the way, you have to be 21 in New Hampshire also to buy tobacco products. You have to be 21 everywhere in the United States now to buy tobacco products. But anyway, the SRO was telling us that, kids will go up to New Hampshire and come back with a backpack full and then distribute them and make a little profit on them. In fact, he said that they had confiscated a backpack full of them in the boys' room at the high school recently. And also, I do think, I know that they're able to get them online because we did a little test seeing if people could get flavored tobacco products online. And I don't know that they sold to anybody underage, but they certainly sold flavored tobacco products online and delivered them in Massachusetts, which is against the law. Mm-hmm. So I wish I could answer you more precisely, Candace, but I think it's a variety of ways that people are getting them, young people are getting them. So we try to nail down what we can and tighten up. And like, I forget if it was Elaine or Laura, I think it was Laura who said, but we don't want to do this in a vacuum, just have regulations. Right. We want to have all the other supportive. And that's one of the reasons that it's great that, we're going to be able to expand our reach with a variety of positions so that we can do more education and we can do more work out in the community on tobacco and other addictive substances and other issues, other health issues, mental health issues, and so on.
I wonder if it makes more sense to put our energies there rather than making a, you know, for example, a flavored rolling paper ban, right? If they can just get it on the internet, then without having to go into a store or show an ID or anything, maybe our efforts are better spent educating more.
I think, go ahead, Anthony.
Yeah, so I guess to some extent, Candace, I think you're right. Part of it is we don't want to continuously play this kind of whack-a-mole game where we're hitting one thing and then something new comes up. But I think part of the youth access, and I would put the flavored rolling paper and then the discussion about Delta 8 kind of in this category, in the sense that with the access, we're also trying to prevent kind of the casual kind of encounter by youth to see this in stores and then decide to try it. I think that's part of the prevention as well. Again, it's very difficult for us to regulate anything that's online, right? And I think, like you said, the education piece is going to be very important, the outreach, making sure that we support a lot of the ongoing efforts that we already have through Youth Action Team and the Alder through Wake Up. But I think it's still part of it. I think we do need to do some of the mitigation that we can when we see these products coming. And I think, Maureen, you can kind of verify this for me if you can, but I believe we've been seeing this starting to take more, to be more common in Malden and Medford. Is that correct? You've been seeing flavored rolling paper showing up.
Yes.
Yeah. So kind of in the bigger cities in our area, they're starting to see more of this. I think this would be a way for us to kind of get ahead of that and try and see if we can limit that in-person exposure. From the online perspective, that's where the education could really help.
And I also think it's a consistent message that we know flavor, anything attracts kids.
Yeah.
And people now are putting flavor in their water. They can't even drink water. They have to have flavored water, but especially with kids, and we have a lot of data. I know Laurel and Elaine, you'll remember the survey that was done by an 84 group, maybe 4 years ago, 5 years ago, or whatever, before the state law, but we used it effectively at the state level when several hundred Wakefield high school kids were surveyed, and they had questions like, would you use, it was a vaping survey, would you use this product if it wasn't flavored? And 65% said no.
Yeah, oh, hell no, it's disgusting. Yeah.
Yeah. So I think the flavor message is a pretty, that's a strong one that we want to make whenever we have a chance to make it. But I also understand, we do want to make sure that, I know you want to make sure that you're making policy that makes sense and is prudent and all, all of that.
Well, one of my thoughts as well, I mean, you're regional. Are you the same region that our new grant is in that we just heard?
Is it the shared service grant?
Oh, yeah, that. See, I told you.
Yes. We're actually in the same, Maureen serves the same collaborative minus.
So, it occurs to me that we should be doing that within the shared services. Maybe there should be an annual shared services presentation to all of the community's boards. Because I do feel like it would be nice if we could make these as cohesive and similar as possible. Sure would make your job easier, Maureen. But
right, because I go around to every board and have
where
this
am
discussion
I?
in every board. Yeah, that would be easier.
Maybe doing
if other boards were willing, I'd be more than happy to do it that way. And a regional approach is important. I mean, you know local regs better than I do, and local public health better than I do. And sometimes it starts with one city or town, and then a few more around there, and then it starts to spread, and then it gets to some kind of critical mass, and then the state will act. With the exception of the flavor ban, where the state leaped ahead of us. But other than that, it's been pretty much local. One or two smoke-free housing started in Cambridge. Smoke-free workplace started in Cambridge, period, and then moved one by one. But yeah, regional approach is always is always best.
Maybe to start with a regional education plan somehow and get that out to our region about this and how it is a concern. And then wait 2 or 3 months and know that after we've gotten a little bit of education in, then put in our own ban and watch, and hopefully the rest of the people in our coalition will go along with it. And I'm sure that they will. Maybe, I don't know. I feel sometimes you got to get that education out first. I think a lot of people aren't aware of these things. I mean, and I think once we get an educational piece out first and try it and see and let people be more aware, and then we turn around and then we put in our restrictions. I don't know. That's me.
Huh.
I'm just curious. So is that specifically more towards the tobacco piece that we've been talking about, or is that even including some of the non-tobacco substances that Maureen's helped discuss tonight?
I think for both. I think, if we do a little bit more education and we make people more aware, then we go to put in and we change our regulations, then I think people are going to understand and be more supportive and more aware of it and take a good look at the surroundings when they walk into a store, Maureen. I mean, how many people walk by, let's say Mark's smoke shop, for instance, and remember the doors were open and the smoke was coming out? A lot of people don't know that that's against regulation. So if we educate the people first, get the message out there that this is what's going on, and as a result of educating them, this is what we're going to do. And when we go to do it, I think it'll be accepted and more, I think it'll get more people aware of what's going on. Make it easier for you, Maureen, too, when you're out there.
And I hear you, Elaine, that there is something that we think about, and that's community readiness. Is the community ready?
Yeah.
With many campaigns, we did a lot of education before we did the whatever regulation it was, and tried to prepare people that why we went to 21 or whatever it might have been. So yeah, I don't think more education is a bad idea.
One of the things I do want to talk up a little bit about is the Delta 8 piece. So not that this would be exempt from any of the education things that we just talked about. I think that's also a great idea. But the interesting part of Delta 8, this is all still a learning process for myself and everyone who talks about this kind of thing. But Delta 8 is not naturally occurring. It's an not naturally occurring extract from hemp. As a result, the state actually does not allow for hemp-derived Delta 8 THC products to be processed or sold in Massachusetts. And so it's one of those things the state actually does not allow, but there's really little enforcement on our side. And so I think because the groundwork has already been kind of laid when it comes to Delta 8, I think it's something that we can consider if we want kind of a local regulation to give us the enforcement backing for stores to not sell Delta 8 products, and especially because a lot of these products are flavored, and they kind of skirt around the whole flavor ban piece of it, right? So I think this one, even though we could use more support from a kind of a regional approach, I think this is one of those things that we could possibly tackle because we already have some kind of backing from the state here.
So what you're saying is you want us, to move in a more forceful and in a way so that we can also manage it. I mean, I don't know that, Maureen, you're certainly the person who's already there looking at the counter, but I don't know if it is in your purview, within the.
So yeah. So technically, no, because the grant pays me to do tobacco policy and tobacco enforcement. What we did in Melrose when we were considering a CBD ban, back when CBD first started coming out, we were seeing gummies on the counter, worried about kids getting it. In Melrose, what we were going to do is if I spotted it, I would call Ruth and Ruth would go in and enforce it.
Yep.
So I was the eyes on the street. Delta 8 now is in, you know, most stores in the city. Certainly it's just become such a hot product. And MDR, Massachusetts Department of Agricultural Resources, should be enforcing it. They have the authority, it's their responsibility, but they don't have agents in the field like DOR does, or
Right.
even the tobacco program. You know, Anthony's point is a good one, that I can tell them to get rid of Delta 8 when I see it. And I always tell them, you know, I tell the store owners things, but I can't enforce things that I can't
Right.
enforce. So if there was a local regulation, that would have teeth in it, because you would put some fine on it if they continued to sell it. So I think that would be the advantage of having a local reg for that covered Delta 8. Because I tell them all the time, you can't sell that, but they're still there.
So the way we usually go about regulations, remind me, since, you know, we've pulled one, you know, is that we find a sample regulation, the health director with any consultants writes their best form of it, and then the board gets to be the editorial board. So I would be, because we might even just, you know, insist that things like Kratom are just positioned differently in the store. Like they can't be, you know, I don't know. I think we have to do a little bit more research on how this stuff is done. And at the same time, work on our education campaign. You know, one of my thoughts is with our CADCA grant is kind of putting in, you know, and I know that we already do a lot, but on communication, sort of have a regular quarterly notice to parents with the school's consent saying, these are the trends we're seeing now. Or, you know, this is what we're seeing at the local corner store next to the Bazooka. There's something called Kratom. You know, this is the definition of Kratom. This is the definition of Delta 8. And just, you know, we'll have people who say, oh, I mean, I could not believe how naive people were to vaping even 3 years ago.
Yeah.
Incredibly naive. So, you know, maybe that's a reasonable approach.
And by the way, Laurel, I think that with Kratom and Delta 8, it isn't even just youth that I would be concerned about.
Right.
It's any use, adult use, because these are unregulated. We're seeing these different reports.
Well, you know, we're going to have a whole big HHS team pretty soon, right? So, you know, I think our communication can then, you know, that needs to be someone's job, Anthony. Like, what are we pushing out to the community in a holistic fashion? So, a year from now, I can do your, you know, Ask Lucy column, but not yet. So.
I think it's a good point. I think a lot of the products obviously are new, and it takes us time to catch up with it, right? And then it takes us time as a health entity. It'll take the community more time to kind of catch up with it, right? So I think you're right. We do have to get that education piece out there. I am obviously concerned about Kratom and Delta 8. Kratom being one of those. I think back in either 2016 or 2018, it was actually put before FDA, and I think there was a push to put this in the Schedule 1 controlled substances.
They got next. Yep.
Yeah, and you know, I think the background was there. I just think that there was enough dispute about, you know, some of the effects that it can cause. But I think that there's, you know, since then there's been research, and you know, most of it has shown that it has opioid-like stimulant effects, and it's one of those things that we kind of have more information on already by now.
Yeah.
And so I think as part of our kind of PSA, right, our regular kind of information on the community, and this is going to be done more through Wake Up and through some of those outlets, but it'll be good for us to get this information out. I just think that, like Maureen said, any use Kratom and Delta 8 is concerning other than youth, but
So at high
don't wanna lose
doses,
that.
it's more of an opiate-like sensation.
Yeah.
You're right. Yeah. Okay. So what are we going to do about this besides feel a little bit depressed?
So I think part of the process is we're going to have to go and put a lot of legwork behind this. We do the research and put together, all the literature that we can find that goes behind Kratom and Delta 8, right?
Mm-hmm.
We want to present a case essentially that these are detrimental, both in the aspect maybe more for Delta 8 than Kratom, but for youth access, it would fall under the similar justification as any other flavored product ban that we've had so far. We would probably also frame the rolling paper, flavored rolling paper, kind of in a similar argument where it really is an enhancer. Similar to any of the other flavored type products. And so we would frame these in a sense that, a lot of these are already backed by previous regulations, previous arguments. We want to make sure that we're not just banning things for the sake of banning things, but I think we are looking at certain substances that could enable youth use. And then on the other side, something like Kratom, just in general, an unregulated substance. So we want to make sure that we're tackling that too. And we would bring a draft regulation with all the kind of background research along with it. We still have the benefit of working with Maureen and DJ Wilson. I'm glad that he's very much on board with helping us with that. So we would be able to bring sample regulation.
Okay. Thank you. It's fun to talk about something new, though it's worrisome.
Yeah.
Thank you, Maureen.
Okay. Thank you all. Very good to see you all.
Take good care, Maureen.
Have a good rest of the night.
You too. Happy St. Patrick's Day.
Oh, that's right. You too. Thanks.
Okay. So I'm glad we covered a lot of that, a lot of the tobacco and the substances other than tobacco topic. I think it's again, it's one of those things that you guys have kind of already gone through, but it's a balance of education, outreach, and the policy behind it. I think it's going to be ongoing, especially now with the increased purchase online and all that. So,
gotta love Amazon Prime. You can get it.
One thing I forgot to mention in the health director's report, just coming to me now. So obviously another good point that I should be writing these down. So the kind of a couple of loose things. Bodywork permits. Bodywork permits in Wakefield is something that we have, I believe as a board, you guys have tackled at some point. This would be new territory for us as a combination, but it's one of those things that we do want to take a closer look at the existing regulations. And we want to kind of see if we want to revisit those. Again, massage regulations are at the state level, but we want to see what kind of local regulations we have in place for bodywork permit places, and we want to make sure that we're updating those as necessary. So we'll keep you up to date on those, and we may before the next meeting we may have maybe a draft regulation or some of the draft changes we want to make to the bodywork permits, and then we'll obviously bring it before the board and we can discuss.
Cool. Are we at other business, Madam Chair?
I think that's all that was on the agenda.
I'm tired. I hate time changes. Tough time.
It's gone now, so you'll be okay, Laura.
I know. Hey, I had two ideas I wanted to share. One was that, the Wakefield outreach, whatever email that we get from communications is looking for some pictures, and it makes me, I have some great pictures from some of our clinics. I don't know that it needs to be on front of the town report, but it does make me think that maybe we can insert some in our website and maybe talk to Jen McDonald about that, or just at least have them make us feel good.
That would be great.
Make us realize that it did happen. And then the other is, I've thought this for a long time, and I don't know if it should come from us, but maybe I should talk to Steve Mayo about it. But I do feel that it would be appropriate and healing to have some kind of memorial, maybe this summer, late spring. I'm kind of envisioning like a lit lantern kind of thing on, paper lantern on the lake, or whatever those paper lanterns are that kind of float up with heat, just to offer some healing to the community for isolation, for recovery, for people who didn't get to say goodbye in the way that they wanted to. There's been a lot of, it's interesting. I was just listening to NPR the other day, and they're actually doing kind of a rolling memoriam. But I just feel like it would be an opportunity. It would be an opportunity to bring people together. Also, it might be an opportunity. One of the things that we've had difficulty doing in Wake Up and trying to get stakeholders of town together is we really have had a difficult time coalescing the faith communities, mostly because they're over busy. And I'm wondering if we did something like this with them, or even just had them do it. I mean, we have an interfaith community board. It may be a much better idea if it came from them and not us.
Or the Human Rights Commission, maybe we could partner with that.
That's an interesting thought. So maybe I'll reach out, but what do you think about it?
It's good. Didn't we talk about this, doing it at one time?
I think so, but then,
we couldn't do it because of the
boomerang to another variant. Like it wasn't over yet.
No, I think it was the restrictions on the amount of people could gather.
Right. I'm talking about outdoors.
Yeah, well, there was restrictions for even that a little bit here and there too. So I think it's a great idea. I know we mentioned this at one time.
Human rights, friends of, I think I've said it before, and then interfaith. All right, I'll see what I'll ask her. I'll see. I think it would be great if it didn't come from the health department.
Go to the Unitarian
I think
Church.
We all need to be there.
Yeah.
I'm just going to nominate Laurel as the head party planner here.
In
advance of all this.
That was my pre-COVID role, for sure.
Bring the juice boxes.
All right. That's all I got.
Elaine, anything else?
We think tomorrow may be the last COVID call?
I think so. Is it the last COVID call, Anthony? Wow.
I believe tomorrow will be the last COVID call.
Friday. Today's Wednesday.
Hopefully,
yeah.
I'm knocking on wood, hopefully for a long time. I hope we won't do this anymore. But yeah, it's we're at that point, I think.
I did notice the school department put some numbers in the item this week, which was kind of nice to see those a little ahead of a meeting, but I unfortunately won't be there for the last one.
I can do audio only. I'm going to be somewhere, but it'd be nice to acknowledge that. And then we all got invitations for something, some town-wide public volunteer.
Did they also include all the volunteers, Laura?
I hope so. I asked them to, but I have no idea.
So I have a girlfriend who's a nurse, and she got this invitation, but I did not get this invitation.
Yes, you did. You got it in your Board of Health email.
No, I haven't gotten anything at my Board of Health email.
Oh, that's crazy.
I got mine on my personal email. So.
I didn't get anything. I wouldn't even have known it was up there. If she didn't, she sent me the email. She's like, "Hey, are you going to this? Let's go to dinner after." I was like, "Oh."
All right, I'm going to forward to it. You're invited.
I'm not friends with that girl. Sorry. It's okay. It's a night I can't go. I have the kids anyway, so it's okay.
Oh, come on.
Unless I can bring them, and I don't know if that's going to be.
It's just well, all right.
Yeah, Paul works late, so.
I have to find you a babysitter. That's all.
We'll see. All right. Well, hopefully I'll see. We'll figure it out. But may I make a motion to
the next meeting?
Yep.
Okay.
Is
Thank
it?
you, Elaine.
What? It's during vacation week. Is that
Vacation week.
okay?
Yeah, it's okay with me.
All right.
You're the only one that has small children. How is
Yep.
that for you?
We're not spending $9,000 to go away for a week, so.
Oh, yeah. Let me tell you.
We're on the 3rd or the 2nd
The
Tuesday.
3rd?
All the way to the 20th. Goodness
Yeah.
gracious. After Easter.
Right before the election.
Do we want to meet in one room or are we going to keep up the Zooming?
Did we meet in person, Anthony, yet? Did you find out?
We are good to go. I thought you weren't going to bring it up, Laurel. No,
I'm glad it was
Break
her.
that promise. You know I break all my promises.
I think we're good. I think we're good to meet in person.
Oh, good. That'll be great, especially when you're doing regulations and things. I find
Yeah.
it's so much easier to be
Maybe
right
we'll
there
do
and be able to do things. That'll be awesome.
Where will the meeting happen then? Where is the room?
Well, we have a couple options. We could do the I guess we could do the small conference room in our department. We could do the lower level conference room in town hall, or even the upper level.
Yeah, we have been doing upper level. If we have public comment, we can't use that small room.
Yeah.
So
most likely either the lower or the upper conference room.
Whatever you can find for us, Cindy.
Well, so the only room equipped to do that right now is the upstairs Selectmen's Conference Room.
Okay.
And I think that they're working on getting the downstairs room done by July. But so you'd be competing with the other 20 boards to get that space, because you have to offer it as a hybrid. So
We still do.
yep, I would think until June.
Oh,
Are we usually the only one that's at 7, usually on the 3rd Wednesday? Who else is?
So because we have to offer a Zoom room, there's only like a limited account. And as you can remember, we've lost our spot if we didn't book the room, the meeting well before. So that's what, so it's all making sense, right? There's only certain accounts. So the five time slots are getting taken up. So I don't know. I did, that's what Sherry kind of told me. So I guess we could follow up with her and see where we're at. But I thought initially it was going to be April, and I mentioned it and she said, no, that's not going to happen just in April. But I'll double check with her.
okay. Well, whenever we can, we will.
Yep.
It'll be the minute that, I want to stay in Maine and you guys insist on a meeting.
No, well, if they're not done till July, maybe there'll be nothing this July, and Anthony will be good.
Nothing to talk about. Oh, that would be so nice. Oh man, the good old
hoping.
The good old days. Okay, well, on that, I make a motion to close the meeting.
I second that motion.
All in favor?
Gorville, aye.
Silver eye.
Linehan, aye.
All right. Good to see everybody. Have a happy St. Patrick's Day.
Thanks, everybody. Good to
And
see you.
Easter, or whoever celebrates.
Bye-bye.
Thank you, everyone.
Take good care.
Night.